Hello everybody, I am Dr. K Taparia, Senior Consultant Pediatrician at Bhagirathi, Neotia and Women Child Care Center, Rawdon Street. Today we'll discuss home management of diarrhea in children. Diarrhea is a very common condition which children often encounter right from infancy till the late childhood. So we'll discuss in brief how to manage the diarrhea in children. Any change in the pattern of the stool, which may be liquidy or more in number, is called as diarrhea. The child may look sick and will refuse to eat or feed, and child may or may not have fever. That means child is sick, having diarrhea. Few babies, or a lot of babies mostly, when they are breastfeeding, they pass small amount of stools quite often while feeding or even after feeding. That doesn't mean that the child is having diarrhea. The child is otherwise active and feeding well, so be assured this is not diarrhea. Diarrhea can be classified into three types: watery diarrhea, bloody diarrhea, and in cholera, which is seen very rare these days, rice watery diarrhea. So we'll try to discuss the management of watery diarrhea or otherwise in watery diarrhea in children at home. So the best management is that we take care of the hygiene practices, hand washing hygiene, and care of the utensils. Use WHO ORS formula to make a good proper solution as per the directions given on the sachet. It is available as a powder packet in small sachet like 4.3 or 4.4 grams, or ready to use Tetra packs are also available. Remember to see the osmolarity, which is 245. This is the newly approved WHO formula. You have to start giving the formula, but remember not to stop the normal feeding pattern and including the breastfeeding. Continue breastfeeding even if the child is passing loose motions. In case the child is vomiting, wait for a while, 10 to 15 minutes, and restart giving fluids. As the babies and children develop diarrhea at home, the first fear the parents have that, oh my God, they'll have to go to the hospital. So I can suggest you a simple formula to avoid the dehydration. Start giving 50 to 100 ml of ORS for every stool that child has passed below the age of 2 years. 100 to 200 ml of ORS if the child is between 2 and 10 years, and more than 10 years, you can replace with 200 to 400 ml of ORS. The zinc supplement is also advised during the cases of diarrhea. The important thing is for mothers to note how to prepare the ORS. It should be made with clean hands, clean utensils, and 200 ml of fluid or 200 ml of water is to be mixed in the ORS packet, the small unit, which is 4.4 grams. Otherwise, the ready to use is available, which is as a Tetra pack. In spite of giving all this ORS, if the child persists to have loose motions in large number or large voluminous stools, or he continues to vomit, or the urine output is very low, the child is very lethargic or having high fever, it is advisable you take the child to the hospital or to a doctor. Thank you.